Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, and I'm excited to do HIV questions with you today. If you heard the HIV testing video yesterday that Mark Klimek did, this is a follow-up to that. So let's go ahead and get started. Our first question: when the occupational health nurse is teaching you the UAP about bloodborne pathogen exposure and human immunodeficiency virus risk, which information is most important to emphasize? Most important. So this is a best question, highest priority, most important, best thing. Okay, they all are answered the same way. Now remember, it has to say best, highest priority, most important in order to know it's a priority question, but we do have that word here. So we're going to read the answers, and what you have to realize is that whenever they ask a best or most important question, they're looking for the most fundamental principle. So we're going to see more than one right answer here, but we have to pick which one is most fundamental, which one do we absolutely have to do. So we're teaching about bloodborne pathogen exposure and HIV risk. Occupational transmission of HIV from patients to healthcare workers is relatively rare. That's actually a true statement. B, occupational exposure to HIV-containing fluids should be reported immediately to the supervisor. That's a true statement. C, treatments for occupational exposure to HIV may include use of antiretroviral medications. That is a true statement. D, post-exposure treatment will include HIV testing at baseline and at several intervals after the exposure. So it could do that. I don't like the word will. Okay, I don't like the word will include HIV testing at baseline. It's probably true, but I don't want to say it absolutely will. And so I don't really want to pick it. Okay. So I'm going to cross off D. The occupational health nurse is teaching the UAP about bloodborne pathogen exposure and HIV risk. Which information is most important to emphasize? Okay, most important. So this is not someone who's been exposed. We're teaching about the exposure. Okay, so they haven't been exposed. If they had been exposed, maybe I would do D, but they haven't been. So this is just a kind of a theoretical thing. So A is true, but it's not the most important thing to teach. Because if the only thing I teach is, well, it's rare, that sounds like I'm going, don't worry about it. Okay, so I'm going to cross off A. So I've crossed off A and D. B, occupational exposure to HIV containing fluids should be reported immediately to the supervisor. Now that is absolutely true, and it absolutely must be done, right? If I'm teaching somebody about exposure and risk, I want to make sure they know if you get exposed, you have to report it to your supervisor. C, treatment for occupational exposure to HIV may include use of antiretroviral medications. That's true, but that is only going to be done if you report it, y'all. You have to report it. If there's only one thing here that they have to know, is they have to know that it has to be reported. Now, I want you to realize all of these answers were true. But the best thing, the most important thing, the highest priority is you've got to report if you're exposed. Okay, now if you're like, I don't get that, Sharon, think about it. I don't want to spend too much time on this because it takes a little bit of time to think through it. But you have to report it. If you can only teach one thing, and everything else is going to get by the wayside. There's only one thing I'm going to teach. You have to report it. Hello, Clinic Review family. As most of you know, this YouTube channel is a part of the Clinic Review NCLEX review business that's run by Mark Klimek. And the YouTube channel is an opportunity for you to see what we do and how we help you pass NCLEX without any cost to you. But we also offer some things that you can pay for that are really worth paying for. And I want to tell you a little bit about those things. So if you go to clinicreviews.com, you will see when you first get there, it'll tell you about Klimek Connect. And Klimek Connect is actually a free community that you can join. And Mark Klimek does participate in the Klimek Connect community. So you can join that. You can actually see some videos from Mark Klimek, and you can have some interaction with him. You can ask him questions and so forth and make recommendations that you would like to see. If you go ahead and scroll down, you actually will see some of the other products that we provide. You can see our world famous NCLEX review that Mark Klimek does, and you can purchase it online on demand. and you can have access to it for a minimum of 3 months. And then I think you can purchase it for a little bit longer. Mark Klimick actually teaches these lectures. They are on demand, so they're recorded, but they're really phenomenal. You're going to learn so much by taking this NCLEX review. Mark developed it specifically for people who struggle to pass. So especially if you're struggling to pass, I recommend it. And then even if you're not struggling to pass or you haven't taken the NCLEX yet, we do recommend, or I recommend, the tutoring. I teach one of the tutoring sessions and it's live stream, so you can actually talk to me, see what's going on, ask me questions personally. Mark Klimick teaches 2 of those live streams, so you can actually meet him and talk to him. And then Dr. Pete or Trevor teaches the other one. And there are obviously there's 4. I just told you there's 4. And they are also recorded so that if you can't attend the live stream, you can watch them in recording. Or if you attend the live stream and want to watch them again, you can do that as well. So these are some of the products that we offer. And I do recommend looking into them. There's some really terrific products. Even if you don't do those, we're so glad you're part of the Clinic Review family on YouTube. And we do want to support you in passing NCLEX. That's our goal across the board, is supporting you in passing your NCLEX and becoming nurses, because we really need nurses to provide excellent care. So we wish you all the best as you prepare to take your NCLEX, and see you later as part of the family. Bye. Okay, 2, the nurse is evaluating a patient with human immuno HIV who is receiving an antibiotic as a treatment for pneumocystis jirovecii pneumonia. Okay, so a person with HIV who's receiving an antibiotic for pneumonia. Now, you might say, well, why are you abbreviating it all? Because I don't know really anything about that specific antibiotic, and I don't know anything about that specific pneumonia. So I'm just going to say, hey, HIV positive person is getting treated with an antibiotic for pneumonia. Which information is most important to communicate to the healthcare provider? Okay, if you've watched my prioritization videos, you know when there's one patient in the question and a diagnosis, and the symptoms or the things to evaluate are all in the answers, you know that we report unexpected findings to the healthcare provider. That's what we report. So I'm looking for things that I go, this is unexpected. For a patient with HIV who's being treated for pneumonia, this is unexpected. That's what I'm looking for, okay? The patient reports a blistering rash. Well, that's unexpected. This isn't a skin infection, y'all. This is pneumonia. And they're taking an antibiotic, and a rash is bad. Okay, that's unexpected. B, the patient's fluid intake is 2 liters a day. That's expected. That's what they're supposed to take in. 2 to 3 liters a day is what they're supposed to take in. The patient's potassium is 3.4. Well, that's a little low. The patient enjoys spending time outside in the sun. That's okay. Now, there are some antibiotics where you can get a sunburn easier when you're taking that antibiotic. And so I don't know if this is one of those. What I'm not going to do is I'm not going to pick the answer I'm not sure about over the answer I am sure about. And I don't know if being out in the sun is a problem. I know 3.4 potassium is a little low, but it's not dangerously low. And I know a blistering rash is bad, y'all. That is, at the very least, they could be having an allergic reaction. I have to report that to the healthcare provider, because this is a pneumonia. Didn't say they had a blistering rash before, and now all of a sudden they have one. Yeah, I have to report that. So when you get a question with one person in the question, the symptoms or the things to evaluate are in the answers. You pick the unexpected finding, and pick the answer you know for sure is unexpected, not the one you're not sure about. 3, which of these patients cared for by the nurse in the clinic presents the highest risk for infection with HIV during sexual intercourse? Okay, so all these people present. Which one is the highest risk for sexual intercourse? So in the blue book, it does talk about transmission and what are the risks for transmission. And exposure to blood is the highest risk for transmission. There is some HIV in semen. Um, the highest viral load is going to be in the blood. Okay, so I want to see where there's a risk for either blood contamination between 2 people, or perhaps blood and semen. That's what I'm kind of thinking of, right? So I'm looking for like sharing of needles, traumatic intercourse that could cause bleeding. Okay, so I'm not going to use. I'm not going to use. Well, I am. I was going to say I don't know if YouTube is going to ding me on any of this stuff. Hopefully they won't ding me on any of this stuff. A, uninfected man, so the man's uninfected, who reports performing oral eye with an HIV infected woman. So we've got a man who's uninfected. So oral route is not a high risk for exposure. Oral route of exposure is not high risk for exposure unless there's some blood, like blisters in the mouth of the person who's exposed. So there's no reason to think A is high risk. B, uninfected man. Okay, uninfected man. So he's not positive, who's the receiver during anal eye with an HIV infected man. So the HIV infected man, the semen is infected, and anal intercourse is considered to be more traumatic than vaginal intercourse. There's a higher risk for bleeding. And it would be the same if it said an uninfected woman who's the receiver during anal eye with an HIV infected man. So it doesn't matter that the receiver is a man. Okay, it's the anal eye uh, that is the risk because it's considered more traumatic. So B is definitely high risk. C, uninfected woman who has had vaginal eye with an HIV infected man. So I would say their second highest risk behind B. Okay, so C is the second highest risk behind B. D, uninfected woman who has performed oral eye with an HIV infected woman. So again, that's an oral route, which is not the highest risk. So A and D I'm going to exclude because those are both oral exposures, which is lower risk. And B and C are both have semen, so those are equal, but only one has the more traumatic uh, type of intercourse. So we have to pick B. Okay. All right. 4, a patient with HIV who has been started on antiretroviral therapy is seen in the clinic for follow-up. Which test will be best to monitor when determining the response to therapy? CD4 level, complete blood count, total lymphocyte percent, and viral load. Okay, so antiretrovirals, think about the name of the drug. It's an antiretroviral, so it kills the virus. Now, as the virus level goes down, hopefully the CD4 count will go up. But just because someone is HIV positive doesn't even mean their CD4 count is going to be low. It doesn't. I mean, they have to have it takes some time for that CD4 count to go low. So we're going to cross off B and C. So it's either between a CD4 and a viral or the viral load. And the antiretroviral is supposed to kill the virus. So I'm going to have to look at the viral load to see if it's working. That's the whole point of taking the antiretrovirals is the viral load decreasing. So I have to pick that one. 5, a patient who has HIV and is taking nucleoside reverse transcriptase inhibitors and a protease inhibitor. Okay, so I'm going to say person with HIV who's taking HIV meds is admitted to the psych unit with a panic attack. Okay, so an HIV positive person taking HIV meds admitted to the psych unit with a panic attack. Which information about the patient is most important to discuss with the healthcare provider? Y'all, it's the same question as before. We have one patient with a diagnosis. The diagnosis is HIV positive and a panic attack. Okay, HIV positive, taking meds and a panic attack. I'm going to report unexpected. I'm going to discuss unexpected things with the healthcare provider. The patient explains, I'm afraid I'm going to die right here. Okay, A is expected when someone's having a panic attack. That is an expected response to a panic attack. That's how people feel with a panic attack. B, the prescribed patient medications include midazolam 2 milligrams IV immediately. So I don't know if that's something that needs to be reported or not. So I'm going to leave a question mark next to it. C, the patient is diaphoretic and tremulous and reports dizziness. All those symptoms are expected with a panic attack. That's what a panic attack looks like. And don't say, well, they could be having a heart attack. No, they couldn't because they've been diagnosed with a panic attack. If they came into the ED with all those symptoms and they hadn't already been diagnosed with a panic attack, I would have to rule out cardiac. But they've been diagnosed, and I have the NCLEX. If it tells you panic attack, that's the problem. Don't be going thinking it's something else. So I've crossed out A and C because those are expected. D, the symptoms occurred suddenly while the patient was driving to work. Again, expected with a panic attack. So A, C, and D are all expected, and I don't report unexpected findings to the healthcare provider. The only one I don't know about is B. And since I know A, C, and D are right, I know those are correct answers, those are fine, I don't have to discuss them. I'm going to pick the answer that I don't know. Now I said don't pick the answer you don't know over the answer you do know. That's true. But here I don't have an answer that I know. The only answer I have is when I'm not sure about. All the others I know don't need to be reported. So what I'm showing you is how you don't have to know every fact to get this answer right. I didn't write this question, y'all. I got this out of a book. You don't have to know every answer to get it right. And I wanted to show this to you because the fact is, if you want to know the fact, is the protease inhibitors reduce metabolism. And so the dose of this medication would have to be reduced when they're taking a protease inhibitor because it reduces the metabolism of drugs. So that's why B is something that needs to be addressed. But I got it right, even though I didn't know protease inhibitors can do that, right? I didn't know they could do that, but I still got the answer right because I followed the rules. So that's all I'm teaching. I'm just teaching you the rules. You don't have to even remember that protease inhibitors reduce metabolism of drugs. Just remember how to follow the rules. Case 6, a patient seen in the sexually transmitted disease clinic has just tested positive for HIV with a rapid HIV test. Which action will the nurse take? So they had a rapid HIV test. That's what Mark talked about in the HIV testing lecture. So we know after somebody has a rapid test, they do need to be confirmed with like a Western blot or something like that, okay? So A, ask about patient risk factors for HIV infection. That doesn't seem like the most important thing after a rapid HIV test. Send a blood specimen for Western blot testing. Okay, I like that one. C, provide information about antiretroviral therapy. Maybe. Would I start them on antiretroviral before I send for the confirmation? I would think I would send for the confirmation before I would give information. And this is a next question, not a priority question. So I find answers that I like, and then I put them in the order, right? So A seems to be something I would do later. I think I would do B before I would do C. So I'm going to cross off C since I would do B before. D, discuss the positive test results with the patient. So am I going to discuss the positive test results with the patient before I send it for Western blot testing? Here's the answer. I put this one on here intentionally because I wanted you to know. Western blot is the confirmation and it needs to be sent for a Western blot. But evidence-based practice says if someone comes back with a positive, even a rapid test, you've got to tell them because they need to know that they could be positive so they can take steps not to expose other people. Okay, so even if the Western blot ends up coming back negative, I need to have told them they're probably HIV positive. It's sort of like all urine and blood tests. All urine and blood tests are not definitive tests for pregnancy. You have to do some other things to confirm it, like you have to do an ultrasound to absolutely confirm that somebody is pregnant. Um, the urine and the blood tests are presumptive tests, but the ultrasound is a definitive test, which is why we do blood and urine tests. We say, hey, you're pregnant, right? But don't announce it on social media yet because we need to do the ultrasound, and we don't do the ultrasound until 10 weeks. So that's why you get all these social media posts where people are like, I'm pregnant. They show their ultrasound picture, right? They didn't announce it back when they just had the positive urine or blood test. They wait until they get the ultrasound. That's the same way with this. The rapid test, you say you're HIV positive, but we need to do the definitive Western blot, right? And so we got to get that. So that's why it's a next question, not a best question. It's a next question, okay? So I hope that helped you, and I hope you have a great rest of your day. Uh, I don't know what the weather's like there, but the weather here is beautiful, and I'm enjoying a sunny day. So I hope you have a great rest of your day.